Hundreds of healthcare workers gathered outside St. Joseph's Hospital this morning to call on hospital executives to back their fight against privatized healthcare. Louis Butko was there for the rally and joins us live with more. Louis.
Yeah, Taz, as you mentioned, hundreds of healthcare workers represented by a coalition of 5 different unions, including OPSEU, CUPE, and the Ontario Nurses Association, representing workers here at St. Joe's. We're taking action against the government's new implementation of Bill 60. Today's rally was the second of 5 planned demonstrations across the province in response to the Ford government's recently passed legislation, Bill 60, and to get a commitment from the hospital's management to defend public health care and fight all attempts to privatize.
The need for the rally is to bring public awareness. The public is not aware what is happening to healthcare. We, the workers, we see it firsthand, and it's so important to educate our public so that they know what is happening on the front lines.
The bill, known as the Your Health Act, was passed last month and allows private, for-profit clinics to provide more OHIP-covered procedures such as MRI and CT scans, cataract surgeries, and knee and hip replacements. Betty Palmieri is president of the OPSEU Local 206 and has worked at St. Joseph's Hospital for nearly 4 decades and says the plan would devastate the services in public hospitals and threaten public health care.
Our rally is about keeping public health care public. We don't want our taxpayers' dollars going to help private clinics set up and take away from the public system.
While the bill has already passed, organizers say the intention of the rally was to send a message to the Ford government to demand an end to further privatization. In an emailed response to CHCH regarding today's demonstration, Minister of Health spokesperson Hannah Jensen says, quote, Bill 60 strengthens the oversight of community surgical settings while protecting the stability of doctors, nurses, and other healthcare workers in our healthcare system. And adds, the bill puts into law that Ontarians will always access insured services at community surgical and diagnostic centres with their OHIP card and never their credit card, consistent with the Canada Health Act. The Ministry of Health adds these new community surgical centres will be required to submit detailed staffing models when applying for a license and how it consulted with health system partners as part of its applications. But Sharon Richer, Secretary-Treasurer of the Ontario Council of Hospitals Unions with CUPE, says that won't help with what she calls the current staffing crisis.
All over the province, we're seeing emergencies close because not enough staff. We know that wait times are longer because there's not enough staff to look after these patients. So, I understand what he's saying, but it's hard to believe that that's actually happening.
Now, Taz, we've reached out to St. Joe's. They got back to us late this afternoon, and they've written us, quote, St. Joe's appreciates the rights of hospital union members to express concerns about provincial issues and met with union leaders following today's provincial rally to receive the signatures of their members. As you saw there, they delivered a petition signed by nearly 60% of their members to hospital executive leadership here.